Do you frequently feel like your heart aches, or you're overly stressed about your body shape? What if I told you that some people feel so worried about gaining weight that they eat a lot of food quickly, like finishing a whole pizza in 20 minutes, and then feel so guilty they make themselves throw up? That's a sign of a serious eating disorder called bulimia nervosa. It's not just about food, it's about emotions, self-image, and control. For example, imagine Sarah, a college student who looks perfectly healthy but secretly eats huge meals when stressed and then vomits to undo it. She feels trapped in this cycle. That's the reality for many with bulimia. It's not a choice, it's a mental health struggle. So what causes bulimia? It's never just one thing, it's like a puzzle with many pieces. Think of it this way. Have you ever felt pressure to look a certain way because of social media or friends? That's one piece. For some, genetics play a role. If a family member has struggled with an eating disorder, the risk is higher. Others might face emotional trauma, like bullying or abuse. Life changes, like starting a new school or losing a loved one, can trigger it too. Perfectionism is another big factor. For instance, Jake, a high school athlete, felt he had to be lean to win races. He started binging on snacks after practice, and then purging because he thought he messed up. The cause, a mix of pressure, identity, and emotional pain. Let's play a quick quiz. Have you or someone you know done any of these? Eating a large amount of food in a short time, like a whole cake, and feeling unable to stop. Then doing something to prevent weight gain, like vomiting, using laxatives, fasting, or intense exercise. That's bulimia in action. Other signs, being obsessed with body shape or weight, going to the bathroom right after meals, swollen cheeks from vomiting, or wearing baggy clothes to hide changes. For example, Mia noticed her sister brushes her teeth non-stop after eating, but it's not about clean teeth. She's hiding the smell of vomit. These signs aren't just bad habits. They're signals of emotional pain needing help. How do doctors know if someone has bulimia? It's not just guessing. They ask questions like, do you ever feel out of control when eating? Or what do you do to avoid gaining weight? They also check physical health, teeth damage, heart issues, or dehydration. There's no single blood test, so talking openly is key. Treatment isn't quick, but it works. Therapy, like cognitive behavioral therapy, helps change harmful thoughts. For example, Lena thought, if I eat one cookie, I'm fat. With therapy, she learns, eating is normal, one cookie doesn't define me. Medicines like antidepressants can help too. Support from family and nutritionists also plays a big role. Recovery is possible, like Tom, who now eats regularly and doesn't purge, thanks to ongoing support. Can bulimia be prevented? Yes, and it starts with healthy habits early on. Ask yourself, do you or your family talk negatively about bodies? Try shifting the talk. Instead of I look fat today, say I feel strong today. Schools can teach body positivity. Parents can avoid commenting on weight and focus on health, not appearance. For example, a teacher starts a self-respect week where students write kind notes about themselves. Media literacy helps too, knowing that edited photos aren't real. Prevention isn't about stopping eating. It's about building confidence, emotional skills, and a safe environment where people feel okay as they are. Good news, science is making progress. Recent studies show that bulimia isn't just mind over matter. Brain scans reveal differences in self-control and emotion areas. New apps now offer daily mood and eating tracking to help people catch triggers early. Researchers are also testing a device called TMS, transcranial magnetic stimulation. It gently stimulates the brain to reduce binging urges. One trial showed 50% fewer binging episodes in participants after 4 weeks. Also, there's growing focus on inclusive care, helping men, older adults, and diverse cultures who often get overlooked. Think of Alex, who finally got help after years because a new clinic welcomed men openly. These advances give real hope for better, faster recovery.